Hello, everyone. What an exciting way to start our new season. In our last episode, I spoke with Dr. Darla Booth on functional medicine and chronic illness management. Let's listen to part 2, already in progress.
So many things to tell you. Like I tell you, I just think I also need to just kind of start on videos, just going through people's blood work and going, here's what I see, and here's why we would start here. And then people can look at their own blood work and maybe make some sense of it.
I do like what you said, that we start from the beginning. You go from the beginning and you're eating just not fruits, but meat and vegetables.
Right.
And you start from there.
Mm-hmm.
Each week you're introducing something different to just to see what is the trigger. I think that is a great approach because
and it's free.
But it'll give us something to work toward, to where we're able to make a chart and say, I'm eating squash and zucchini.
And it's called the autoimmune paleo diet, or AIP. So you can look that up and it can tell you these are the places that you start.
Okay.
And this is how you do this diet, right? I think that if patients do that, I have a patient that just started with me on my autoimmune reset program like 3 weeks ago, and she came to me and she goes, I'm already on AIP. And I'm like, hallelujah. Now I'm afraid to eat any foods. And I'm like, okay, let's see what makes sense to start next. So we've been approaching some different foods, and she's feeling pretty good. So yay, we've expanded, right? And she feels really good about that. But she's like, my symptoms are all gone right now that I'm on AIP. I don't want to eat anything else. We can't stay on AIP together forever.
But what about the sugar addicts? I'm one of them.
So you know what you do first is we really have to start focusing on adding protein. I want you to add protein, and I want you to really eat meat like it's your job. I really do. Because if you can get protein, and I want people to eat meat, I really do. I actually have a very hard time calming down autoimmunity with people that are vegan because I have a hard time stabilizing their blood sugar, and they're leaning a lot on grains. So if I can get people to eat meat, like have some breakfast sausage, have some dinner from stir fry from last night with ground beef, I don't care what it is. It's like this weird diet you have to do for a couple weeks on AIP, right? But I want you to eat 30 grams of protein for breakfast and for lunch and for dinner. If I can just start there, and we can add some vegetables into your diet, then all of a sudden you feel like your blood sugar is a little steadier, and you're not on a roller coaster of blood sugar up and down because you're eating less carbs. And it's not that you're really eating less carbs for sure, but you're eating so much protein that it kind of crowds out the sugar a little bit. I don't go for take away everything right away. I'm like, let's start with adding in proteins and some extra veggies that people like. And then they go, hey, I feel a little bit better. My blood sugar feels a little steadier. I might be craving sugar just a little less. And that's a platform that we can work from, right?
Okay. Right.
People are already suffering and feeling terrible. And if I tell them that they can only eat 5 things, they're going to be like, I hate her, you know? So, and they're not going to be compliant. We have to make it approachable for people. But if they could do AIP for a couple of weeks, I feel like I want people to be just curious. I want you to be curious about how food makes you feel, because I don't think you know. And I want you to see how, then let's put, cow dairy in and see how it makes you feel. And then all of a sudden you have a headache and you're like, that is a really interesting answer. But you wouldn't have known that if you eat a little bit of cow dairy every day. It's like you have this low-grade inflammatory response like all day. And then you kind of go, I don't know, that's just my normal headache I have all day. I don't know. But then when you take it out and you feel like, oh, my headache feels a little bit better, and then you put it back in and it comes back, there you go. Then you know. And when I say dairy, I usually tell people cow, goat, and sheep, get it out. Just get it out and get the gluten out. But the gluten is tricky. I have a whole list of where you can find gluten, because gluten can be tricky. People eat out and they have French fries that are cross-contaminated in a fryer with chicken nuggets, and you might as well just eat the chicken nuggets. So, you have to be pretty fastidious for a couple of weeks. And then you move into trying some things and see how you feel. But if you're having sugar cravings, I'll tell you what's happening. You're eating something that's a little carby and sugary. Your blood sugar goes up. And then a couple hours later, it goes down, and it goes down a lot. And so when it goes down a lot, you feel a little bit panicked and a little bit urgent, like, I need to get my blood sugar up again. And so then those sugar cravings come in because they're for self-preservation. Like, you need to get your blood sugar up. So then you eat a sugary, carby, whatever, and then your blood sugar goes back up too high. And then it goes back down too low. And now you're on Mr. Toad's wild ride all day. And you feel a little bit anxious at the top, and you feel a little bit depressed and yucky at the bottom, and you feel a little sugar hangover at the end of the day, and you just don't feel well fed. And you just feel like, I don't know, I just don't feel good. If you can just shove in protein, I tell you, breakfast sausages are my favorite thing to have for breakfast. Or if you can have, and you have your chicken with your lunch, and you have your steak with your dinner, whatever, have your fish, whatever it is you like, then you start feeling more steady. Because when you have sugar cravings in the day, you might be dropping on your sugar in the middle of the night, and it might be giving you some insomnia too.
That makes sense.
You got to keep your blood sugar steady. So I like people getting these little Stello blood sugar monitors, because then it's kind of like, hey, watch your sugar and see if you can correlate how it makes you feel. And then we're just curious. It's not me wagging my finger at somebody. It's me saying, let's look at this together and what makes sense. And then we learn. And then you learn more about, like, this is your body 101. Like, this is how your body actually works. You just never were taught, right?
Exactly.
Mm-hmm. And then it's not shamey either, because I think there's a lot of shame in all of this. And people trying to stick to diets, trying to figure it out for themselves. And I tell people, this is exhausting. You need a person that can be like your little guide to take you through it and go, okay, this module is not for you. You don't have to worry about that. But this module, this is for you. Like, really kind of moving people through a program so that at the end they go, oh my gosh, now I get it. And I'm going to teach my aunt who also has this, and I'm going to teach my daughter who also has this, and I'm going to teach my sister who also has this.
That's what I was just thinking, because I right now have been on this kick about being an advocate for myself and for others. Yeah. And I get frustrated when I hear someone says, the doctor said they gave me some pills and told me to go home. It's in my head. Mm-hmm. They can't find anything. And so I'm like, okay, what about us? We know what we're feeling. Yeah. I'm telling you something's wrong, but you're telling me just go home and take a pill. Mm-hmm. Who do I advocate to? Who am I supposed to talk to? And someone is going to take what I'm saying and take my feelings and do something and work with me.
Yeah, exactly. Well, it's just me.
That's what I was just saying. I need someone who can say, okay, let's look at the diet. Let's look at your stress level. Let's look at this. Most doctors don't tell you that.
Well, and the people that I was trained with, we were all trained under a really brilliant guy named Dr. Datis Kharrazian. And he has the Kharrazian Institute. It's Kharrazian, Kharrazian Institute. You can look up KharrazianInstitute.com and look at a provider list. All of us have been trained in this, and we all have had a very extensive autoimmune education because it's such a big deal, and it's what we are running into. What I like so much about him is that he teaches this thought process on how do we take this complex person, pull out their symptoms, and figure out where to start. Because what I don't like about some practitioners that are doing this work is they're like, oh, it always starts in the gut. We have to start with the gut. It's like, no, not everybody. I mean, really, not everybody. What if you had a head injury that caused your vagus nerve to get screwy, and now you have constipation, and now you have overgrowth of bad bacteria in your gut? It didn't start in the gut. It started in your brain. Like, you have to have somebody that kind of really looks at the big picture. But that is his biggest training that I feel like I'm so indebted to him about, is that this is how you think. This is how you work through a patient. And don't just jump straight and go, oh, bloating, it's SIBO, better go get some Xifaxan. No, let's really look at this. Like, if this person has a low thyroid and they don't have enough T4, their intestines are slow. They have constipation, and now they have overgrowth because their intestines, the food is sitting in the gut for too long. So it's really a thyroid problem. So you can't just kind of pick up part of the body and say, this is the most important part. This is where we start. When you have somebody that's telling you that, they don't know enough to really know how to think through this. And so I would say if people are looking for a practitioner who can help them through this, that the Kharrazian Institute, I feel like, and he's doing a lot more functional medicine training out in the world, brilliant. Just changed my whole life. changed my whole practice, changed my ability to be so confident in how to pick apart the most complex person. And at least say, here's what we know and here's what we can fix. I might not be able to make you 100%, but let's make you better.
And you're going to help so many people.
Oh, I just have such a passion for it. It frustrates me so much. I'm positive A&A to go toward lupus, and so is my daughter. So I tell you, you get a kid of yours that has this, and you're like, I'm going to figure out every single thing on this to sort this out and solve this for her and me, and now I can tell all of you, right?
Yeah. That's why I'm on board.
No, I love it, and I think it's a journey, and I actually am looking forward to getting some more groups of people together to go through this process together, because I think that everybody has a different something going on, and I want to get a group of people of 20 or 30 or 50 people to kind of go through this together on Zoom, and then we all help each other. And then so-and-so says, oh my God, I have this great paleo, muffin mix I'm going to share. Great, amazing. We are all collaborating, and we're all feeling a lot less alone, because this is a very scary, isolating conditions that people feel like it's only them. And it's not only them. Every other person that comes into my office has an autoimmune disease. So I just kind of want to bust that theory and say, you're not alone, and there is help. I want to create a support group. I really do.
I promise you that is how I feel. I've been trying to do this empowerment and illness, the podcast, but I want it to be a community.
Mm-hmm. Me too.
I feel like there's a lot that we can learn and try to help each other.
Mm-hmm. Absolutely.
There are different autoimmune diseases, right? Hashimoto's, lupus, right? MS. Mm-hmm. So you have all of those, and they got their title, but it all goes back to the immune system. Mm-hmm. And so as a group, if we're learning as a group, if we can help each other as a group, we can put an end to it or help us control it. Right.
And at least empower people to know, oh my gosh, I'm having a flare because of X. Yeah. And now you know what X is, and you go, you know what? I really need to be very fastidious about my sleep. And I need to be very careful about my vitamin A, because I know that that's where I'm going to get hit. Or I need to be really careful about, not getting exposed to whatever food is triggering you, right?
Mm-hmm. Because you went out to lunch with someone.
Right. And you got sloppy and you forgot to say, listen, it's not just a preference, it's actually an allergy. I need you to be careful on the gluten. And they put croutons on your salad, and then they go, oops, and then they pick them off. And then you have just that type of trace bits of gluten, and then all of a sudden you're triggered, right? So we have to know what's important though, too. I want people to get some sort of reverse osmosis water filtration system in their water. Amazing, because then we're exposed to less heavy metals, right? There's so many things to go through. I just want to go through each bit and have all these teaching warriors that can go out and say, yeah, you have to get off plastics. Yeah, you have to get off gluten, and then just be able to teach everybody.
I think this is going to do a lot of help, especially the people that I see on TikTok.
Yes.
Because there are a lot of people just hurting and don't know the first step. And you're right, you go into someone's live, because I know I did. And I'm like, okay, you're telling me that there's a cure. What's the cure? What can I do? Tell me what I'm supposed to do. And I've been asking the wrong question. Mm-hmm. Why is it happening? I should be saying, why is it happening? Not what can I do?
And anybody who says that they're going to cure autoimmune disease should get the Nobel Prize for Health, and they will win that prize. So if anybody's saying they're going to cure this, you don't cure autoimmune disease. You try to get it into remission. You try to calm down the immune system. You try to calm everything down. So, I can fix it or I can cure it. I just go, unfollow. I'm done with you. You have to be realistic. The immune system has flipped on a switch. And now you have control over the volume knob, but you do not have control over the switch.
Exactly.
But you can calm it down, and you can dim that light, and you can bring it down, and you can make it super manageable. We just have to know, what your particular triggers are.
I'm so glad that we got a chance to talk. I am.
Me too. This is great. I love that you're creating a platform for this, because the biggest challenge for me is, how do I get this message out to everybody? I just want to educate people. I need the information to be on a really easy to access platform, so that I can have everybody get it. Everybody gets to have it, because I talk to a lot of people, and I talk to some people in, Western Michigan that have, 2 pennies to rub together. And I'm like, they can't afford to work with me. And this doesn't feel fair either. Right.
Yeah.
And so I just have to figure out how to make it like it's a platform where they can go through it on self-paced. They can do it in a group, or they can do sort of a concierge work where it's just me and them. And that's fine. I don't care either way. I just want to get the information out. Right. And I'm looking at everybody's blood work, and I'm giving assessments, and I'm giving them guidance. And so that's my 3-tiered plan that I'm putting together. And I have the autoimmune reset program going. I've already put like 7 or 8 people through it. And now we're those were my beta people that were, I'm like, do I have the right data? Do I have the right information? Does this feel like it's in the right order and all that kind of stuff? And now we're rolling. It's great.
That's awesome. I am excited too. I'm so glad that we got a chance to talk, because it put things a little bit more into perspective for me.
Mm-hmm.
It just tells me I'm on the right path.
You are. And if you just keep moving, and I'll tell people even on TikTok, send me your labs, and I'll give you a little bit of they have limited labs, but here's what I see, right?
Mm-hmm.
How about you start there? Trying to give people tips and tricks to try and start, right?
Yes. That's why I said the diet. I can see pushing the diet and saying,
mm-hmm.
okay, I know you have the sugar craving. I
mm-hmm.
know you have the stress. So let's try to eat this thing, or let's work on breathing a little bit more. When
mm-hmm.
you know something is coming up, just take a pause.
Take a pause, go for a walk, right? Figure
mm-hmm.
out, do I need to put yoga as a regular practice? Do I need to put Pilates? Do I need to make sure that I'm going to have coffee with a friend? Do I need to make sure that I'm, walking with a friend, or have a exercise buddy, or, talk with somebody and say, hey, let's work on this protein together. I love that sort of checking in with people and being that sort of partner with somebody else, right?
Yeah.
And then you're not alone. Yep. I love it.
I do too. I'm so excited.
I know. This is going to be great. I love this. And thank you for bringing this to me, because I want more than anything to get on more podcasts and speak more to people and educate people about, the do's and the don'ts on autoimmune disease. It's when you really look at it, it's just like your body's just not happy with the situation that's going on. How do we change it to make it calm down?
Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow. Give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you reach 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When someone passes away, they have the day they were born and the day they passed away. There is a dash in the middle. It's not a long line. It's a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. Dr. Booth, thank you so much for joining us today and sharing your invaluable insights into the world of functional medicine and chronic illness management. Your dedication to a patient-centered whole-body approach truly offers hope and a path forward to those seeking comprehensive care. Please let our listeners know how they can reach you.
I am on all the social media platforms under Dr. Darla Booth, just DRLA BOOTH. You can follow me on TikTok, on Instagram, on Facebook. I do have a practice here in Los Gatos, California, and my website is darlabooth.com. If you want to reach out, if you're in the area, if you want to come see me in person, if you want to follow me on social media, if you want to start the Autoimmune Reset program, just let me know. I'm happy to help.
Thank you so much. To our listeners, remember that you are not alone in your health journey. There are resources and professionals out there like Dr. Booth who can help guide you toward better health and empowerment. Thank you for tuning in, and as always, take care of yourselves. Remember, you have the strength, the heart, and the support to continue your journey. Be safe.